Hello everyone, I am Dr. Tejasvi Bodchalla, consultant doctor in Fidicus Homeopathy. In our previous video, we discussed about what is thyroid dysfunction, its causes, and also what are the different types of this thyroid dysfunction. In this video, we will mainly focus on the symptoms of this thyroid dysfunction and how these symptoms can impact on our pregnancy, and also how to diagnose this thyroid dysfunction. I can explain this clearly on the board. Let's move on to the board. Now, coming to the symptoms of thyroid dysfunction. Usually, thyroid gland located in the lower front part of our neck. This thyroid gland produces T3 and T4 hormones. These hormones regulate the body growth. When there is imbalance in these thyroid hormone, results in the symptoms like hypothyroidism and hyperthyroidism. Let us go through this one by one. One is hypothyroidism. Hypothyroidism means underactivity of thyroid gland. In this hypothyroidism, thyroid gland produces less amount of hormone. Results in the slowing of the body functions like results in fatigue and also weight gaining. And other one is cold intolerance. It means unusually complaining of coldness and also excess hair growth, hair loss sometimes, and also constipation feeling. In women, menstrual irregularities like irregular or heavy bleeding may be seen in hypothyroidism conditions. So these symptoms may be seen in hypothyroidism conditions. Next one is hyperthyroidism. Hyper means overactivity of the thyroid gland. In this hyperthyroidism, thyroid gland produces more amount of hormone. It means due to this production of excess hormone, it can speed up the body growth functions. It can speed up the body growth functions and causing symptoms like palpitations, increased heartbeat, and also heat intolerance. Another one is weight loss. Weight loss may be seen in this hypothyroidism condition. Weight loss may be seen in this hyperthyroidism condition in spite of increased appetite and also feeling of anxiety, heat intolerance, and also tremors may be seen in this hyperthyroidism condition. In females, in especially hyperthyroidism conditions, the menstrual irregularities like absent or scanty periods may be seen in this condition. These absence or scanty periods may cause difficulty in conceiving. So both this hypothyroidism can cause different symptoms in our body, and also some autoimmune conditions like Hashimoto's thyroiditis and also Graves' disease. These conditions cause symptoms silently but can impact our fertility mostly. So this condition also causes recurrent miscarriages, often causing anovulation cycles. Even mild thyroid dysfunction also cause severe impact. So identifying these symptoms in essentially fertility workups. Now coming to how this thyroid dysfunction can impact on our fertility. Usually thyroid hormones can control the ovulation process, menstrual cycle, and also female reproductive health. When there is imbalance in these thyroid hormones, it can result in the improper production of the reproductive functions. When there is disturbance in these thyroid hormone, it causes symptoms like irregular and anovulation cycles. It means absence of releasing of the egg from the ovaries. This may cause difficulty in conceiving. So women may get infertility. And other one is menstrual irregularities. Menstrual irregularities in the sense causing heavy or irregular bleeding and also sometimes scanty or absent periods. These may also disturb the normal fertility outcomes. Other one is luteal phase defects. Luteal phase is the last phase of menstrual phase. This phase is essential to maintain the implantation and also helps in the continuation of the pregnancy. When there is disturbance in these thyroid hormone, results in the luteal phase defects. This leads to early miscarriages, and also in some patients it may increase the risk of miscarriage like improper implantation. Along with this, it can also affect the continuation of the pregnancy and also some development of fetal malformations like premature birth. Fluctuating blood pressures may be seen in this thyroid dysfunction, along with low birth weight babies, and also some complications may be seen in growth of the baby. Apart from this thyroid dysfunction may also seen in males also. In males, due to this thyroid dysfunction, it can affect the quality, motility, and the quantity of the sperm production. Thyroid dysfunction can not only affect the females, it can also affect the male fertility. So identifying these thyroid problems and also treating is essential in fertility workups. Now coming to the necessary investigation to identify this thyroid dysfunction. Usually in infertility cases, the first most common test is thyroid test. In these tests, identifying in these thyroid profile should be done. It like T3, T4, TH levels should be known. By knowing this, you can identify the normal function of the thyroid gland, evaluating the function of the thyroid. Other one is autoimmune screening. In this, anti-TP or anti-TG antibody should be screened. when there is any presence of these antibodies, can identify the autoimmune disease conditions. And also, ultrasound may be suggested in thyroid dysfunction. Why it means by this ultrasound, we can identify the any nodular growth or any improper functioning of the thyroid gland should be known by this ultrasonography. Other one is apart from these thyroid hormones, other hormonal tests should be done. Why means these thyroid hormones can also impact on the other female hormones like estrogen, progesterone. Other hormonal tests should be conducted like follicle stimulating hormone test, luteinizing hormone, prolactin hormone, progesterone hormone test should be done. And also complete fertility evaluation should be done in these infertility cases. Complete infertility evaluation means examine both the partners completely, take menstrual history, sexual history, and also other infectious history should be evaluated to identify these causes. So these are the necessary investigation to identify the thyroid dysfunction. Early identification, proper treatment is essential in thyroid dysfunction to maintain a healthy and balanced life. If you are struggling with these thyroid dysfunction and infertility issues, Fidicus homeopathy is the best option. What do you get from Fidicus homeopathy? Means the success of case mainly depends on three main steps. One is the treating doctor, second one is the infrastructure we have, third one is the drug device we are following. At Fidicus Homeopathy, doctors are with passion, qualification, knowledge, experience, competence, and compassion. The drug device we are following is of top quality medicines. We are getting our medicines from best pharmaceutical industries, and we are also best in segment. The infrastructure we are using is of latest technology and also artificial intelligence. By using this latest technology and artificial intelligence, we can give better results to the patients. All these are the advantages of selecting Fidicus Homeopathy. Now coming to the consultation part of Fidicus Homeopathy. Fidicus Homeopathy provides two types of consultation. One is online consultation, other one is in-person consultation. In online consultation, audio and video call options are available. By using these options, you can share your reports to us. If any reports are necessary, we will let you know. You can get it back locally and send it back to us. After completing the case taken, the main treatment will be started. Once the treatment is started, we will ship your medicines to your doorstep wherever you are in the world. If you are staying in India, it will take 3 to 4 business working days. If you are staying other than India, it will take 3 to 8 business working days. If you want to consult Fidicus Homeopathy by in person, you can visit our nearest branch and get consultation. Now coming to how to consult Fidicus Homeopathy. This is our WhatsApp number 7997101303. By using this number, you can call or message to us and get consultation. If you have any doubts about Fidicus Homeopathy, this is our website www.fidicus.com. You can visit our website. By using this website also, you can get consultation. Why Fidicus Homeopathy only? There are so many homeopathic hospitals are there. So many corporate hospitals are there. Why Fidicus only means Fidicus Homeopathy stands for highest chance of health, and also Fidicus Homeopathy mainly follows three main principles. One is the highest success rate, second one is the transparent treatment, third one is the personal care. Regarding this thyroid dysfunction and infertility issues, Fidicus Homeopathy having highest success rate, and we are also providing transparent treatment. Transparent treatment in the sense we can explain the condition to the patient clearly and also prognosis to the patient. We are also providing personal care. Personal care in the sense we can give each and unique treatment to every patient, and we also advise them to maintain a healthy and balanced life. All these are the advantages of selecting Fidicus Homeopathy. Now we discussed about the symptoms of thyroid dysfunction and how these symptoms impact on pregnancy and what are the necessary investigation to diagnose this thyroid dysfunction. Remember, this thyroid dysfunction is manageable with early diagnosis and proper treatment. If you are struggling with these thyroid problems and infertility issues, Fidicus Homeopathy is here to help you with safe, effective, and timely treatment. Thanks for watching.
Fidicus Homeopathy.